my PhD proposal, which I don't know where is this. What is it? Yes, that's it. Okay, and I would like to present my PhD proposal, which is about we'd like to improve the patient safety, and this is through an in-depth exploration of non-technical skills training for undergraduates. So, what is the problem? The problem is that we as a clinicians, we provide healthcare services for our patients, and being normal individuals, sometimes we are, as a patients, we receive patient healthcare services, and we think that it's in the optimum condition, and everyone is happy, and our patients are really safe and secured. But the numbers don't say this, actually, because in the United States of America, about 44,000 to 98,000 of unnecessary death occurs every year due to medical errors. Add to that, more than 1 million excess injuries happen also due to medical errors. In UK, it's 130,000 medical errors constantly happen every year. And if we can say also in UK, 60% of the prescriptions done is by junior doctors. And I'm sorry to tell you that 7 to 10% of these prescriptions, there are clinically significant errors. So we have frequent medical errors in our healthcare services. And when we go in depth why we have this huge number of medical errors, we would find that the failure of non-technical skills is the core behind those numbers, those big numbers of medical errors, because it represents 70% of the incidents in medical practice, and we can say in the emergency room, it's the heart of medical errors in the emergency rooms. Also, in the pre-operative period, it represents about 60% rather than technical skills problems. In a recent Delphi consensus study, and this included more than 100 expert laparoscopic surgeons, they concluded that biliary injuries occurs during laparoscopic cholecystectomies due to non-technical skills rather than technical skills. So we have here, we can put our hands on the real problem of medical errors, is that we have non-technical skills issues. So we as educators and educational institute, how do we see this? The General Medical Council in England in 2009, they stated that junior doctors are expected to demonstrate effective non-technical skills once they graduate, from day one. Okay, but does this happen? Actually, no, because the research demonstrate that new doctors have difficulty demonstrating effective non-technical skills. And this is why, because traditionally in our education, in all health profession education, we insist on attaining technical skills for our students, and we don't give that attention to the non-technical skills. So at the most, we are giving them how to technically perform their work, how to do clinical reasoning, but actually we don't teach them how to work in a teamwork effectively, especially during critical situations. And that's why, that is because we think that non-technical skills, there's that concept that non-technical skills, which is competent, which is mandatory for competent practice, could be acquired through the on-job learning experience. It could be acquired through time. It could be acquired through the experience in clinical context. But actually, this is not true. Non-technical skills has to be structured to the students, has to be taught for the students. So what are non-technical skills? Non-technical skills, these are skills that enhance your way, or your team member, his technical skills, his technical tasks or procedures. It's a combination of cognitive skills, social skills, personal skills, three main domains. Underneath these three main domains, we would find a subdivision of different skills. So we have to concentrate about this, because this is the solution for our problem, is to minimize the number of medical errors and to ensure that our patients are safe. We have to teach our students non-technical skills. And this is one way which is could give us a very good results about the number of medical errors. I just want to give a hint about the aviation industry. Because we are similar to the aviation industry, both the healthcare industry and the aviation industry, they are both considered as high-risk industries. And actually, they were brilliant enough to precede us in this field, because in 1979, there was a huge research about what is the causes of aviation accidents. And they found that 70% of the mishaps are due to non-technical skills. So they created that crisis resource management course training program that emphasized the non-technical skills very well in a very good manner. And that's why GABA in the late 90s, he adopted this training program from the aviation industry, and he identified, he adopted and he implemented in the anesthesia field, actually, and he identified the anesthesia crisis resource management is the ability to translate the knowledge that needs to be done into effective teamwork, even under unfavorable or unclear conditions of the reality of real medical emergency. And simply, we can say that crisis resource management addresses the non-technical skills necessary for effective teamwork. It's designed to manage and prevent as much as possible from critical events among individuals. Going through in depth in the literature, we would find certain gaps. To begin with, is that in the last decade, several trials of teaching non-technical skills have been done, but also that they were mainly focusing on the education, could it be successful or not. They overlooked the question of how certain education tools are effective. And also they lack clearly defined learning outcomes, a conceptually underbent pedagogy, and replicable educational materials. The offered training that has been done usually was paradoxically given to homogeneous teams of learners. So we have to think about these areas, how to study them in depth. Also, we have no idea about the attitudes of our students towards patient safety. And we don't know their motivation to learn non-technical skills. And according to the David Merrill's first principles of instructional design, principle number 2 states that learning is promoted when the learner's background and knowledge is activated. So at least we have to know what's our students' background in order to instruct a non-technical skills training program for them in a proper way. Gap number 3, which is introducing non-technical skills training and assessment into the core curriculum of healthcare professions is still early. We need leadership and resources to be pushed into this field towards getting the optimum non-technical skills training for the undergraduates. Gap number 4, it was up till now, we don't have this published results of statistically powered experimental study of interdisciplinary health professions undergraduates teams evaluating the impact of CRM training, because we work in a teams, which is interprofessional teams. So we have to think about education in interdisciplinary manner. So we have to think about teaching our students in interprofessional way. So up till now, we don't have this statistically powered experimental studies for undergraduate especially. Lastly, Petrosanik and Hicks, they were doing research on crisis resource management, and they indicated that there are 3 areas to improve the future CRM training. And one of those areas was the shared mental models. And we ask ourselves, does shared mental models between team members could enhance the outcomes of crisis resource management? So all these questions or gaps will be included, wrap up in my questions that what are the different approaches, assessment measures, and outcomes that have been done for the undergraduates? We need to know that. What is the medical students' attitude towards patient safety, and what is their motivation to participate in simulation-based learning to learn non-technical skills? And what is the impact of virtual simulation online course on teaching medical students non-technical skills? How to develop an effective, efficient, and engaging course of CRM to the health profession undergraduates. What's the impact of simulation-based CRM training on interdisciplinary teams for final nursing and medical students? And lastly, does augmentation of crisis resource management with shared mental models training improve students' performance? So these 6 questions will be answered in 4 studies, and I could go through and quickly through my studies. Study number 1 is going to be a scoping review, just to highlight and to get a review about the current approaches, the assessment measures and outcomes about what have been done for the undergraduates. Study number 2, students will be, it's a prospective cohort study with a pre-test and post-test design. 250 medical students will answer questionnaire about attitudes of patient safety and motivation to learn non-technical skills. And in between the pre and post-test, they will be exposed for online course for non-technical skills training. Study number 3, it's going to be a web-based Delphi study for designing a CRM course for final year health professions undergraduate using 5-star instructional design method. And using this, the outcome of this study, which is the CRM course, we will use it in study number 4 and see what is the outcomes of teaching the health professions undergraduate final year students of CRM. And this was going to be through participating 180 students, and they are going to be divided into 3 cohorts. 1 is a control and 2 experimental cohorts. So within these 4 studies, I'll be able to answer the 6 research questions, and that's it. I think I'm running out of time. Thank you so much. I wish you a lovely day.